So good morning, everybody. It's 386 days since our first case. Just completed 55 weeks. We're in the week 56, hard to believe. And today is Good Friday, so I want to wish everyone celebrating on Sunday a happy Easter. Thank goodness we had no one pass away last night. But to the 366 family members that lost loved ones, again, our prayers and condolences go out to you. To all the families that lost someone during these difficult times. We know it's been a trying year for you and your family. As of today, there's now been 22,440 cases of coronavirus in Albany County to date. 45 new positive cases since yesterday, and we saw 90 new cases the day before that, and there were 75. Our 5-day average of daily positives is 64.8. Yesterday it was 72.4, so we've gone down, which is good. And there's currently 1,538 people under mandatory quarantine. Yesterday there was 1,535. We had 15 cases that are close contact to somebody. 29 don't have a clear source of infection. 1 reported traveling out of state, and none are healthcare workers or residents at a group setting, which is good. A little update on our nursing home. We still haven't gotten to the point where we can open it because I know the governor opened it up, and it's like the details, or the devil's in the details, so to speak. You had to have a negative COVID-19 test for 14 days to open it up. They just changed it to 7. So we're hoping that we don't have a positive. And you got to remember, we got a lot of workers that come and go, even though most people are vaccinated. And Dr. Welling can talk about it. Even though they're vaccinated, we got people that will come back with test positive, or we get new workers, and unfortunately, they test positive. I'm hoping to get our doors open soon to our nursing home because these people want to see their families. They really want to see them. So, again, bear with us on that. So there's 21,872 people that have tested positive for the virus and recovered. It's 59 recoveries since yesterday, which is all good stuff, going in the right directions. Please remember, though, people that do recover do have a long road. Not everyone. Unfortunately, there are some people that need lung transplants, other issues going down the road. So it's good that they recovered, but they still have a road ahead of them. 5 new hospitalizations overnight, 21 people currently in the hospital. And it's good to see that number coming back down. It's going back up to 34 on the March of 26, but we're back down again. And we're at 24 residents currently in the hospital, like I said, which is good. The numbers going down. Unfortunately, we have 4 patients in the ICU. We had 4 people in the ICU the day before that too. Our 7-day average, which we all know we all pay attention to, right now it's at 2.5%. This has been slightly rising since March 15th when it was 1.6, so that is going up a little bit. We got to be careful of that. I like to say there's good weather. It snowed twice yesterday, which I was like, okay, welcome to the Northeast. But it's supposed to be nicer next week. And I know as people go out, please, Dr. Whalen and I have said this 1,000 times, just socially distance, get out, hike, get fresh air. It's good for your mental health. It's good for your health overall, and I know the light's at the end of the tunnel and we're almost there, so we want you to go outside and get exercise, but please just remember, stay socially distanced, wear a mask in public, cough into your arm, clean your hands, and stay 6 feet apart, and we'll continue to get through it. I keep saying it's a marathon, not a sprint, and we're almost there. So you also got to remember there's still there's other threats of this virus, and Dr. Whalen can talk about it, but we really haven't seen much here, thank goodness, but it has, like I said before, in New York City, Connecticut, New Jersey, they're getting a spike, and other places across the country are getting a spike with this other strand, so we still have to be cautious, but we're getting close to getting back to where life used to be, or so to speak, what the new world's going to look like when we stop wearing masks and everything else. There's people out there who are saying that the vaccine isn't safe. Please, I've said this 1,000 times. Educate yourself, read about it. Remember, not everything on Facebook or social media doesn't have to be proven. People can just say whatever they want and put it out there. Go to your local media. Go to a trusted website that has information out there. The FDA did approve the vaccine. It was through emergency rush, and Dr. Whalen can talk more about it. But it went through the process. It was vetted. It's continued to be studied because, as you know, they're trying to lower it to 16-year-olds. They got a study going on with pregnant women. So it's all being done and getting out there. So please, the vaccine is safe and effective. And we need it. People that are out there shopping, you can look at different websites. You can find out what vaccines where. We'll give it a little bit, but I will say this, please. I know everyone wants the Johnson & Johnson. It's one shot, you're done, you move on, and I get it. But if you're available to get any of the other two, take it. Don't wait for the Johnson & Johnson. And we'll talk about a little bit where that's going. But if you want to see if you're eligible, please go to the website or call the hotline at 1-833-697-4829. Again, you can always use the United Way 211, the hotline, for getting information and helping you walk through it. We still have issues with that. And to date, some of the good things, Albany County has administered or reallocated 39,664 first and second doses, and that includes the Johnson & Johnson to partnerships, because we're going to get partnerships to get this done. I want to thank Dr. Whalen and her team, my team in my office that's been working with partners all over the county to make sure we make it easier for people to get vaccines. That's why we find some of the smaller pods we have done at St. Sophia's in the different communities throughout the city of Albany into underlining health communities that have underlying health issues, or this have affected more the black and brown community, of getting single pods, because it works. People like going to their churches. They like going to where they're familiar, feeling comfortable. And logistically, Dr. Will tell you, it's a lot harder to do a pod for 75 or 100 people or 50 people, but the outcome is great, and the smiles on people's faces. It takes that anxiety away. And again, they trust going to their church rather than going to UAlbany, the Washington Armory, our Times Union Center, CAP Center, where we're at that point in time. So please, there's over 7,000 additional vaccines since our last briefing. With our own vaccine clinic, Albany County has administered 25,107 vaccines. Yesterday alone, our Department of Health, and again, thank you to Dr. Whalen and her team, administered 915 first doses, 1,526 second doses. We also partnered with the Capital District Latinos for a pod yesterday where there were 77 people who were able to get their second shot. It was awesome at their church. Had a great time, and again, it's the buy-in in the community and people just feeling comfortable going where they're familiar. So, and it was a lot of Dr. Whalen's team that was there that was giving the vaccine out. So thank you to the workers, and thank you to the medical corps and the volunteers, and obviously to everyone that set that up. So part of our efforts to ensure the vaccine is given out in an equitable manner to make sure that we're hitting the communities that were hit the hardest. So again, I do want to thank everyone involved, making sure we're getting into these neighborhoods like we did the walk up with the COVID-19 testing in these little pods, because they do work. We also were able to get 19 people the shot at the Times Union Center off our standby list. So we did say yesterday we would do a standby list. You do have people that are scheduled to get a shot, or they got it somewhere else, or they back away. So we did the standby list, and I'll get into that in a second. But I'm saying this to everyone: please listen. Just don't show up. Don't show up if you're not on that list. And if you need to, you can email us, and you can please send an email to COVID vaccine standby list at albanycounty.com or albanycountynewyork.gov. Sorry, I'm used to the .gov. And we will get you on a standby list. We will email you. Dr. Whalen and her team will make sure that you're on that list and you're eligible for the shot. Just don't show up and hope that you're going to get a shot if somebody didn't show up. You get vaccine hesitation, people that don't cancel their appointment, unfortunately, or people that just walk out because their nerves get them and they get nervous and they leave. So, and at the end of the day, our goal is to get a vaccine in someone's arm when you have it out. So, one of the great things I want to say, yesterday, 38% of Albany County population has received its first dose. Remember that I go, it's like watching the stock market. We get to that 70%, you know, things change. More stuff starts to open up as we go down the road. So people that have received their first dose, we estimate 23.5% have completed the vaccine altogether, which is good. Compare that to the statewide's first dose administered. It's at 31%. Second dose is like 18.5%. So we're ahead of the trends. We're getting more vaccine into arms here. And I do want to thank it is a team approach from Alliance for Better Health to everyone that's involved. Our pre-registration tool, please get involved. Rensselaer County's on it now. Steve McLaughlin signed off on it. Schenectady County's on it. Rory Fluman signed off on it. And basically, you know, we will grab from that list. And if you live in Schenectady and Rensselaer, we'll get you there. And if we might have Albany County residents go to Rensselaer or Schenectady. That's okay too. We just want to get shots in arms because, again, we realize in the Capital District we're in this together, and the only way we're going to get through this is getting everyone vaccinated as quickly and as fast as we can. Which is, I'm happy about Monday. Yeah, I believe it's Monday, right? Yep. That are starting April 6th. The eligibility list will extend from 16 and up. I was glad last Monday I advocated for it. It's time. We got more vaccine coming in. We always had, Dr. Whalen and I would say here, we've always had the demand. We just didn't have the supply. Now we're getting the supply. The supply is going to continue to come in. And that means you're going to see more partnerships, more vaccines getting out there. So again, people pay attention. Everyone over 30 right now, starting Tuesday, April 6th, it's anyone 16 and up. So please do our pre-registration tool, and you won't have anxiety. You won't have to worry about finding a shot anywhere else. We will contact you and we'll set it up and we'll get you in. So again, please work with us. I do want to say thank you so much to the volunteers and the Medical Corps Reserve. I know Dr. Whalen does it all the time. It's not possible to do this stuff without people in the community to stand up. And I got to meet the doctor extraordinaire that made Dr. Whalen everything she is today. She was there, and I can't remember.
Dr. Mary Applegate.
Yes, thank you. And she was great, came out of retirement, and she was there proudly helping us out at our pods and saying that she basically trained you, and taught you everything. So she was taking credit for it. But, what a great lady, and it's great to meet all the doctors that have come out of retirement to help out with this. So please, everyone can do something, be it just walking somebody through, talking to somebody, holding their hand, letting them lean on you. I will say to the media, I'll challenge you, you should really well, if Dr. Whalen lets you, you should pick someone in the crowd and walk through with them and see what it's like to really start from the beginning of the process to getting registered, going through it, getting the shot, and the care that goes into it. And it's really about the care because, the people that are registering them, the people that are giving them the shot, and the people that are standing by just in case they have a reaction, or to the point where they go and wait 15 minutes. You should really experience that and see what it is. And it probably would help people with anxiety realize that, hey, it's okay, and the support is there for us if we need it. But again, thank you to the volunteers. I also want to say that Walmart pharmacies are adding vaccine locations in Albany County and throughout the Capital Region. Before that was the Albany location on Washington Ave Extension and Glenmont on Route 9W. They both are offering the Pfizer vaccine. So now you're also seeing Sam's Club in Latham with the Pfizer vaccine, and Walmart and Latham will be offering, Walmart and Latham, and I'll say this, will be offering the J&J. There's people that out there that did get the J&J. They'll be offering it there. But please, I know people want that. If you can't get in, get the shot wherever you can get it. You can make appointments now. The vaccine starts tomorrow from them locations, so you can call there, go to their website, and get on the list if you're eligible to get it. But please, those who are not eligible yet, again, like I said, next week you'll be able to start 16 and over, and we won't have these issues, which helps us a lot. And the hardest thing, and I've seen it on Dr. Whalen's face, and I'm not trying to point around, is it's hard when you turn someone away that's not eligible, and she can't give the shot. Trust me, she's a doctor. She wants to give the shot to you. But if you don't meet that requirement, we are faced with $1 million fine and lack of vaccine going into the future. We actually did get a letter fining us because they had some of the information wrong, and we straightened it out. But it's hard. It's hard for any doctor. It's hard for any volunteer to say to you, hey, sorry, you don't meet our eligible requirement for us to give you that vaccine. So the clarity of now that we can do every group is, trust me, it's a relief off of all the workers, because no one wants to argue with somebody or tell them that they have to go somewhere else. You can find all of our information on albanycounty.com. Use the red bar across the top, which takes you to the COVID page. And please just remain patient. And sometimes you're in and out in 30 minutes, sometimes you're in and out in 15 minutes, sometimes you're in and out in 45 minutes. I will say to people, we have got nothing but positive feedback. Sometimes I do talk to people saying that took me an hour to get through, or it took me 2 hours. How long do you usually wait in your doctor's office for an appointment to see your doctor on your yearly physical, or your dentist, or wherever you're at? Just be patient. People are trying to get the shot in arms. And again, all right, if it takes an hour out of your life, waiting there, that's one more step closer to getting open. Dr. Whalen.
Good morning. So yes, we are still working very hard to get vaccine out in the community. I want to say that we are very grateful this week that there has been expansion of the eligibility criteria for vaccination, which enables us to get vaccination to more people. We started with the 30 and over group and look forward to next week, where everyone over the age of 16 will be eligible for a vaccination. I do want to appeal to people that have been in criteria, people who have coexisting medical illnesses, perhaps elderly. There's a lot of people out there that still decided to wait and decided to see how people did with vaccine before they made the decision to get vaccinated themselves. I hope that the months that we have been doing this have been providing reassurance to those that were a little concerned about the vaccine, that this vaccine is safe and effective. We have seen a change in our trends from older people predominantly being infected to younger people being infected because of the vaccination. So we know that this vaccine is protecting people from getting COVID. So if you are eligible, and when you are eligible, it is time to be vaccinated. We want to be able to go forward into the spring and summer months with reassurance and with the possibility of being able to resume some sort of normalcy to life. I think that's a goal that we all share. So hopefully that individuals will make decisions so that we can all have that decision together. The standby list that we implemented yesterday was very successful, and we will continue to do that with clinics going forward. As you know, our clinics are full usually when we release the link. But due to no-shows and due to other considerations, for example, sometimes when we're drawing up doses, we may get 11 doses out of a 10-dose vial. We do sometimes have extra at the end of the night, and we do not waste this vaccine. So this means that if you are available for a last-minute call, and last night around 8 o'clock we started making these calls and had individuals that had indicated their availability on the day that were expecting the calls and came right down. This is very helpful for us, so we don't have to stay too much later. We had 3 pods yesterday between 10 in the morning, and staff left last night probably after 9, and many staff reported this morning at 7:30 to start drawing up for another pod today. So as the county executive indicated, I also want to really give thanks to the dedication of our staff and our volunteer workers. It just cannot be stated enough how hard people are working to ensure that we get vaccine to Albany County residents. We have staff that are working overtime or shifting their time, taking time away from their family and loved ones to work late into the evenings and early in the mornings. And really the results have just been fantastic. And despite that really long, the long work hours, I think what we have found when we come together and work under in the vaccination clinics, people find that there is an atmosphere of joy. People find that there is an atmosphere of reassurance. People find that they get individual attention if they are concerned or nervous. They have time to have their questions answered if they have questions. We have, as Mr. McCoy indicated, many retired doctors that have come and assisted us, many doctors that are still working that come and assist us, nurses, and people that want to be helpful. So we have people that are working on flow that help the lines move more quickly. We have people taking temperatures as people come in. We have people doing triage, registering people that come in, vaccine assistants that ask health questions at each station. We have monitoring physicians and healthcare professionals who make sure in that 15-minute period after people get vaccinated that they're not having any discomfort or need to ask any questions. And we have people cheering you as you're on your way out the door. I think the volunteer that was doing that last night may have woken up hoarse this morning because she was very rambunctious with congratulating people, particularly when they got their second dose on the way out the door. It's a good atmosphere, and I can't say enough how proud I am of the Albany County Department of Health staff that do this on a daily basis. I know I've mentioned many names, and I would like at some point, to be able to give special consideration to all the staff that have done this. It is really a group effort. Headed by Tricia Bellato, who is our Director of Emergency Preparedness, and Mary Beth Miller, who is Deputy Commissioner. We have Eileen Franco, who's come to us from retirement from the state, who's assisting as pod manager at the majority of the pods. Mary Brummagem, who was with us for many years as our vaccine coordinator and is now coming out of retirement to lead the pull team. Shanna Witherspoon, Assistant Commissioner for Finance. Stephanie Notar, Mevish Badi. There are so many people every single day that assist with these clinics, and I would like to sit and list all their names, but it's impossible to do. One thing I do want to say that's very important for people that are looking to vaccinate 16 and up. Of the formulations that we currently have available, there's Moderna, there's J&J, and Pfizer. It is important for people to know that Moderna and Johnson & Johnson are only authorized for over 18s. So currently, Pfizer is the only formulation that can be offered for a 16-year-old. So if you are looking to have your 16-year-old vaccinated, you want to make sure that the pod you're signing up for, the vaccination that you're signing up for, is Pfizer. Because we cannot vaccinate 16 to 18-year-olds with those other two formulations. So that's very important for people to know. Again, I want to stress the importance of knowing when you're fully vaccinated, which again is 2 weeks after your second dose before you can be considered protected. And finally, I want to wish everybody that is celebrating a happy Easter, but again, really caution about large gatherings. If you look at the trend, the numbers are not going in the direction that we want them to go. We started a downward trend, and now we're kind of at a period where we're looking at slight increases. It's unclear what this means, but what we don't want is an uptick. So as I've said many times, It is very important that we realize right now we are in that race to make sure that we can outpace COVID by getting people vaccinated and by continuing the important mitigation efforts as we move forward into the spring. And please, I hope to see you at the Times Union Center. Come down, get vaccinated. There are many sites in Albany County if the TU is not your first choice. But just sign up, get vaccinated, and let's move into spring.
Thank you, Dr. Whalen. And I do have to clarify that your teacher, your doctor, she did say you were one of the best students she ever had, and you taught her a lot. So I thought I'd get her in a little trouble tonight when you saw her. Again, thank you to you and your team. And before we wrap it up, I do want to recognize April as Sexual Assault Awareness Month. Our County Crime Victims and Sexual Violence Center does incredible work 365 days a year. I made it part of my state of the county. We have a new location. We are not going to tell you where it's at, where women and men that are sexually assaulted can come to this place in the privacy of a place and not feel like they're being judged walking through our front doors currently as they do right now and going through security. There will be security there. There will be things that will be in place to protect people, and I look forward to that. And I look forward to working on a more bigger project with Karen Ziegler and her team at Lawson at a camp where they can come and people can get the help and healing that they need, and do it in the serenity of being in the wilderness and letting their kids be kids and doing this program. But I also do want to thank General Shields from New York Army National Guard and everyone up there that makes this so important, the training that you need to go through for sexual violence year-round, and to the military brothers and sisters that I have that will be involved in this project. Also talked to this Air Force lady yesterday, Heather, about this project, and I've talked to Chief Warrant Officer Kelly Fancher, who also, I'm going to get them involved, so now you're going to get officially notified to do a joint project for military and for the civilians here in Albany County, and it will be a capital district wide. We're not going to say no to anyone. It was one of the things when I talked to Pete Gannon from United Way, their involvement will make sure this is just not open to Albany County residents, but to the Capital District, to anyone, to have the first kind of a retreat for people to go to and get the healing that they need in a secure manner with their children. Also want to please help us bring up awareness by wearing Till on April 6th for Wear Till Day. And that goes through April the 28th, and that's like a blue and green color. So please get that out there and let people know. And then also our 24-hour sexual assault hotline number, 518-447-7716. We also added the text chat feature. It's also available for the website, so people that are afraid to call or if someone's in the room with them, they can text us. The support's there 24/7. These men and women do a great job, and again, it's a tough job that they do day in, day out around the clock. So our mental health support line is available 7 days a week, 8 a.m. to 5 p.m., 518-269-6634. Just did a webinar with Voorheesville School District. To the principal, thank you. To everyone that was involved. It has really affected children too, and we've said this number, please parents call this, or take the time, uncles, nieces, whatever you are related, if you know a child, take the time to just talk to them. The world has changed for everybody. It has affected kids in a huge manner, being home, not being in school, not being able to hang out with their friends. And unfortunately, we lose 16 people a day nationally to suicide teens. That number was going down up to 2019. It was of decline. And unfortunately, I'm not going to want to really see the numbers for 2020. And unfortunately, girls have outdriven the boys in suicide attempts. So please take the time, talk to your children, and make sure that they're doing okay, and try to understand it from their lens, from their point of view of how this new environment's affecting them and yourself. Everyone handles stress differently. Not everyone's the same. I've said this before, Dr. Whalen's stress level and my stress level are a lot higher than other people. But it doesn't mean you're a weak person. It just means that, you know, you handle things differently, and talk to someone about it. So please take the time, talk to a loved one, and we'll get through this. Please be safe out there. Continue to cough into your arm, clean your hands, and stay 6 feet apart. Wear a mask.